located. We're taking it very, very seriously, but
really
glad
careful.
to be here. Very glad to be here. We will be answering your questions on the coronavirus throughout the broadcast, but we begin with where we stand today. This is a track of cases just this week. There are now more than 14,000 reported cases in the U.S., nearly quadruple the total on Monday. The death toll has climbed to at least 205 people.
California is now under a statewide stay-at-home order, the first state to take that step. Here's what Governor Gavin Newsom had to say last night.
There's a recognition of our interdependence that requires of this moment that we direct a statewide order for people to stay at home. Let's bend the curve together. Let's not regret. Let's not dream of regretting. Go back, say, well, you know, we coulda, woulda, shoulda.
California is the most populous state in America. It's also the world's 5th largest economy. Jamie Yuccas joins us from Los Angeles. Jamie, what does it look like where you are?
Well, Anthony, I am currently standing on the iconic Ventura Boulevard here in Los Angeles, and you can see not many cars around me right now. And normally this time of day there would be some traffic. Governor Newsom will keep essential businesses open. That means things like banks, also grocery stores where you can see there's some deliveries being made this morning. They also will keep open pharmacies, and here in California, that also means marijuana dispensaries will stay open, as well as takeout restaurants. But other things like furniture stores, barber shops, record stores, those types of things that you see up and down the boulevard, they will all be closed. Newsom said the decision comes as California plans for a worst-case scenario where 56% of the state's residents contract coronavirus. That's more than 22 million people. Officials believe that could lead to more than 19,000 people in the hospital, which would overwhelm current capacity. But the governor says that this stay-at-home order is meant to starve off those worst-case scenario numbers. And by the way, if you don't shelter in place and stay at home, you could face a misdemeanor, which means also a fine. Tony.
Jamie, thank you very much. And behind the numbers associated with the pandemic, of course, are thousands of individuals and their families dealing with heartbreak, dealing with isolation, and in a growing number of cases dealing with grief. David Begnaud is focusing on some of those stories.
A 4th member of a family who lives in the northeastern part of the U.S. has died from coronavirus. 7 members of the Fusco family have all tested positive for the virus. Meanwhile, in Southern California, one of the youngest individuals to contract the virus has passed away. 34-year-old Jeffrey Gazarian, a cancer survivor who had recently visited Disney World and Universal Studios in Florida, died Thursday in California. Also in California, there were images of another patient in an isolation chamber being loaded off of a private jet by workers in hazmat suits.
Of course, he was very, very anxious.
The 65-year-old patient was transported to Los Angeles from Aruba, where he tested positive for the virus. The flight was chartered by Jet Rescue Air Ambulance and was lined in plastic. 2 pilots, a doctor, and a paramedic were on board.
We basically started an IV and sedated him so that he would go sleeping all the way in the chamber, because it could be very difficult to be inside of it.
We are putting all of our healthcare workers at the front line. Some of them are going to get sick.
In New York, medical student Ruth Howell has seen the human suffering firsthand.
There are a lot of people out there who have a lung disease or high blood pressure or something else that's weakened their immune system. They're more vulnerable to this.
For CBS This Morning, I'm David Begnaud, here in New York.
It is so important, don't you think, to put a face on what is happening in this country, for people to understand how serious this is. I think some people still don't understand. This is a very serious crisis situation.
Well, all you have to do is see the way that man was transported.
Exactly.
It's terrifying to be in that too, but if you're not taking precautions right now, look at that and start.
That's why they say stay home, stay safe. CBS News has learned the Trump administration is now planning to close the southern border today to all non-essential travel. Meanwhile, lawmakers are working on a plan to give cash to Americans taking a financial hit. That is a lot of people. The president is also pushing the FDA to fast-track the drugs to treat the virus. Weijia Zhang reports from the White House on that.
It could be a game changer.
President Trump projected optimism on Thursday when he announced a drug called chloroquine, commonly used to treat malaria, had been approved by the FDA to ease symptoms of coronavirus.
It's been around for a long time, so we know that if things don't go as planned, it's not going to kill anybody.
But FDA Commissioner Stephen Hahn quickly clarified that even though chloroquine is approved as a malaria treatment, the drug must still go through clinical tests to see if it's safe to use for coronavirus. So far, no drug is specifically approved for treating it, even though there are several candidates.
We may have the right drug, but it may not be in the appropriate dosage form right now, and that may do more harm than good.
On Capitol Hill, Senate Majority Leader Mitch McConnell unveiled a $1 trillion financial aid package to help small businesses and industries like the airlines that are hemorrhaging money. The proposal would also send direct payments to many Americans, up to $1,200 per person and $2,400 per couple.
We need to take bold and swift action as soon as possible.
But there are lawmakers on both sides of the aisle opposed to the idea of giving out cash, arguing it's a short-sighted solution.
I don't think that's a good idea now. You can't stimulate something that's padlocked.
And Democrats were quick to criticize the GOP's plan for prioritizing large corporations over individuals.
It provides a bailout for a number of industries. Again, we have to put the workers first.
The White House announced last night that the G7 gathering of world leaders that was scheduled to take place at Camp David in June will now be held over video conference instead. Tony?
Like so many other conferences these days, Weisha, thank you very much. We want to get to our Dr. David Agus, who joins us from Los Angeles, to talk about possible treatments for the virus. Doctor, good morning. We're also hungry right now for any kind of good news. The president wants to fast-track a drug used to treat malaria for application to coronavirus. What more can you tell us about that? Is it promising?
Well, there are two drugs, chloroquine and hydroxychloroquine, that are approved, that are on the market, and I can write a prescription for today. In fact, I have over the last several weeks. And they certainly seem, in pilot studies, to have an effect on the virus and hopefully to make people do better. So this is real hope with these two drugs. And they're here and we're using them. And so it's optimism. And I was very excited that the president took that step forward yesterday. I am pushing him to go further and actually say use it early. Use it in people who are exposed, because we have to stop the spread of this virus.
So these could be preventative drugs, David?
Well, right now they're treatment. They're treatment with significant disease. You know, the problem is that when you come to see me, I do your test. It may be 3, 4, 5 days till I get it back. And what we know with these drugs is the earlier you use them, the better. So, again, I think people should be treated with them when we think they have the virus. And then if you're a first responder, if you're a doctor, a nurse, a healthcare professional, and you take care of a patient who's spreading the virus, maybe you should take them to prevent the spread. Those studies are ongoing. But we in the field cannot wait for those studies. And now we have optimism with real drugs that are here today.
So, David, at what point do you give these drugs to someone who's been infected? And do you have concerns about fast-tracking these drugs?
Well, again, I don't even know what the word fast-tracking means. The drugs are available. They're here today. So you may fast-track their FDA approval, but I don't care if they're FDA approved or not. We are using them. And so we're using them as early as possible in patients with this disease. And this is doctors across the country are talking about it and using them. And we've been doing so for several weeks. But obviously, when the president endorses it yesterday, use is going to go up.
Yeah, I like it when Dr. David Agus says real hope.
Yeah, yes, I like that too. Dr. David Agus. David, thank you. The State Department is now warning Americans to avoid all international travel. Those currently out of the country have been urged to return immediately, but it's not that simple, according to Americans stuck in Peru and Morocco.
They had police guarding the gates and said I went up to try to talk to them, and they said, you know, all the flights are canceled. You can't come in unless you have a ticket for tonight.
We're really relying on media at this point to show that there are U.S. citizens that are desperately trying to get home.
We want to make sure we're advocating for the other U.S. citizens that are here that, you know, might be running out of medication or they have children they need to get back to.
Boy, this comes as FEMA is taking charge of the federal response to the coronavirus. Only on CBS this morning, FEMA Administrator, that's Peter Gaynor, joins us to discuss. Good morning to you, Mr. Gaynor. Good
morning, Gail. How are you?
I'm okay. I'm okay. We're all worried about everybody else. President Trump says he's now fully engaged at the highest level, that FEMA's fully engaged. So what specifically is FEMA doing to help?
Yesterday, we began to take over for full operations, coordinating the entire federal effort here in the National Response Coordination Center. We combined Secretary Azar's Operations Center, the SOC, here yesterday. So all of government is under one roof. We're social distancing, and we're throughout the entire building. We're teleworking to make sure that we can do this or respond to this virus in the long haul, because it's going to be a long battle.
So what's your top priority, and what specifically does this mean when you said we're all together under one roof? What are you guys doing?
Well, my top priority is protecting my workforce and protecting the American people. So I got to do both at the same time. The second priority is making sure that we can respond to the coronavirus like we are today. And we need to do that for the long haul. We have many priorities that we're working on today, to include supply chain management, making sure we get those requests filled by governors across the country, and many, many other things that we're trying to untangle and make better connections.
Mr. Gaynor, we're used to seeing FEMA providing supplies and shelter in natural disasters. Are you equipped to handle a pandemic?
We are. We're ready every day. So whether it's a pandemic or it's a hurricane, FEMA is ready. And it's just not FEMA. It is really the whole of government. I have at my disposal every single federal agency, partners, commercial partners. There's nothing in my way from coordinating, and we're ready for today, and we want to be ready for where we are in 2 weeks, and we're ready for a natural disaster. So we're doing both things simultaneously.
Mr. Gaynor, could you put a little more meat on these promises and these specifics here? What kind of equipment or supply chain management are you working on? I mean, let's take testing, for example. We know that tests need to be distributed. More people need to take them. Are you coordinating that effort?
We are, along with my medical expertise partners, HHS. We're working on everything from testing kits to swabs to PPE, you name it. When it's in demand by every single governor across the United States. We're trying to make sure that we have a way to prioritize needs based on requests, based on risk, based on we think where it's going to be today and where we think it's going to be tomorrow. So all those things are factors.
There's enough heartbreak to go around. We've all heard the stories, but in particular, we did a story here the other day, Peter, about the healthcare workers that will break your heart, where they're saying we just don't have the supplies we need to help the people that need it. Is FEMA doing anything to help them to make sure they get everything that's available to them?
Well, again, I think one of the best things we did is we combined operations. We tried to streamline the process. So whether it's a healthcare director in a state or it's an emergency management director in a state, those two things are combined. So all those resource requests are coming here to the NRCC, and we are validating and trying to fill every single need. However, this is a shared responsibility. It needs to be locally executed, state managed, and federally supported. The only way we're going to beat this is we do it together.
All right, FEMA Administrator Paul Gaynor, thank you very much for joining us this morning. 4 U.S. senators, including Intelligence Committee Chair Richard Burr, reportedly sold stock before coronavirus fears sent the markets plunging. One congressman is asking the Securities and Exchange Commission